increasing the thank you. We're looking at increasing the uptake of screenings offered in the Croydon area. Okay, because screenings have relatively been low for the last 2 years in Croydon, and that's screenings for all different types of cancers. Today, we'll be speaking with the amazing Dr. Judith Mabere. Yes, I got some of her time. Very hard to get hold of because she's a very busy lady, but thankfully she was able to meet with us today and speak to us about breast screening, the process of it, and gives us some tips on how we can self-examine at home as well. So, Dr. Judith, can I hand over to you?
Hello, good evening, Lorraine. It's a very kind introduction. I haven't been called amazing quite a long time, so thank you. I am equally grateful for your time. It has been said before that you can always make more money, you can always buy a better car, you can always build a better house, but you cannot get your time back. So I am grateful to Nadine and to everybody on this meeting because you're giving me your ears and your time, and I'm sure you could all have found something much more interesting to do this evening. So I'm greatly honored by your attention. My name is Dr. Mabere. In fact, it is a Kenyan name. The pronunciation is Mbaire. And I'm sure my grandmother would turn in her grave if she heard how I have anglicized my name. But it has been done purely for the purposes of convenience. In my consultation, I have 10 minutes. And if I have to spend the first 2 minutes explaining to a patient how to pronounce my name, it takes away from my work. So thank you so very much for having me here this evening. Before I was a GP at Patchmore, I have done many things. And one of the things I used to do was that I used to be a health screening GP for Nuffield Health. I'm sure most people on this call have heard of Nuffield Health. They're a private provider. And what I used to do for Nuffield Health, along with dozens of others like me, was health screening. And they still do them. And the health screening session with the GP in Nuffield, I think used to be around £650 for an hour that you pay to Nuffield Health. But what that taught me is that actually I am the same GP in Nuffield as I am in the NHS. In the NHS, I get 10 minutes with a patient. In the private sector, I get an hour. So how can I try and make a difference? How can I share some of that knowledge with my ordinary patients who don't have pockets that are as deep? How can we as ladies, because we all have breasts, how can we all learn and teach each other so that we can pick things up early? And this evening is intended to be towards that. So without too much further ado, I am going to launch my slides. Can everybody see my slides?
Yes, I can see.
Incidentally, please, I would like this to be completely interactive. So if I say something that doesn't make sense, please interrupt me. Please don't wait until the end. I am also a Croydon patient. I live in Croydon. I work in Croydon. I love Croydon. And you almost certainly see me in Tesco before the week is out. So if you have a question, please interrupt me and ask me. Be more than happy to assist. So we're going to start off by speaking a little bit about breast cancer, breast self-awareness and self-examination. Breast self-examination. My intention is not to make any of us experts in breast conditions, but there are many different conditions that can affect our breasts as ladies. Benign is just another way of saying harmless. So different types of harmless breast disease are things called a fibroadenoma. You can also get breast cysts. You can get harmless diseases of the nipple, such as nipple eczema. For ladies who have had surgery, who have perhaps been breast cancer survivors, they get certain post-operative lumps where they get liquid collections. They're called seromas. And of course, there are breast cancers. You will notice I put breast cancer at the bottom because, of course, that's the word that everybody looks for in a breast presentation. But I just want us to be aware that there are more type of breast lumps than there are cancers. This is an image that I have borrowed from oncolink.org, and I want us to understand a little bit about the structure of the breast. Okay, so on the left side of your screen, you will see we're looking at the right breast from the front. We have the nipple. The darker area of skin around the nipple is called the areola. And you then have beneath the skin, you have a network of glands, also known as lymph nodes, which are indicated in this picture in green. if you now got the lady to turn to the side and you were able to slice through the breast in that way, then you would see the image on the other side, and we can see what we all know, which is the breasts are predominantly fatty tissue, but they are fatty tissue that is under the control of hormones. Okay, the things that I want to draw your attention to, if you look very closely, I want you to appreciate that there are things called lobes and there are things called ducts. And ducts are tubes, and lobes are the squidgy things at the end of the tubes. Okay, I want you to remember those two because you will need that information for, I think, the next slide or the slide after that. So, breast cancer. How many women, how many cases of breast cancer do we see? So breast cancer is the most common cancer in women, and in the UK, it is the second most common cause of death. Of all the ladies diagnosed with cancer in every year, around a third of them are new to breast cancer. We should also remember, ladies, that 1% of breast cancers also occur in males. So we may have husbands, brothers, sons, grandsons, males who notice or report a lump in the breast need to see one of us as GPs, and it warrants referral to the hospital. Some of the time they are harmless, but we must not forget that breast cancer does affect the men in our lives. We must also not forget that it's not just about, cancer and cancer treatment. Anybody who has ever gone through any significant illness will tell you that there is a huge amount of upheaval that goes with being unwell. Not being able to work, having a reduction in income, not being able to care for your loved ones, especially if you have elderly parents or you have small children, all the challenges that go along with illness. And sometimes we don't measure these outcomes, but they can cause considerable stress. Now, most breast cancers arise from either the lining of the ducts. You'll remember from the previous slide, we saw the tubes, they're called the ducts, or the lining of the lobules. Let's go back. Okay, you can see the lobes. The lobes, they're a little bit like little balloons at the end in pink. So breast cancers can either be ductal or they can be lobular. And if you've ever read anybody's notes who has got breast cancer, you will hear them talk about things like ductal carcinoma in situ. And it just tells us that the origin of the breast cancer was within the ducts. There is also a condition called Paget's disease of the breast, where the nipple starts to become very odd in appearance. Ladies, I don't need you to remember the names, but what I want you to start to appreciate is that we need to know what is normal for us, so that if anything changes, we will know to pick up on the change. You can't hope to pick up change if you don't know what's normal for you. So 50,000 cases of breast cancer each year, and about a quarter of these are picked up following mammograms. I've got a couple of slides about mammograms a little bit later on, including I will tell you how to get a mammogram if you've missed your appointment. Okay, now I want to talk a little bit about risk factors for breast cancer. I can't emphasize enough that a risk factor is not the same as a cause. Okay, so breast cancer is a condition that we see in increasing age, but we must not forget that somewhere under 5% of new breast cancer diagnoses are in ladies under the age of 35. So yes, it is rare in those under 35, but it is still seen. Less than 25% of breast cancers occur in those under 50 years. So what that's telling us is that 75% of breast cancers are found in ladies over the age of 50. So I can't see the pictures of most of the people on this call. I can only see myself and Lorraine. And I think it's fair to say that Lorraine is under 50. But as for the rest of the ladies, just bear in mind that 75% of breast cancers are in those ladies over the age of 50. Between 16 to 19% of women have a history of breast cancer in the family. Now, whether this is due to genetics, whether this is due with shared lifestyles, whether this is to do with the environment, whether it's to do with chance, or all of the above is something that is still in discussion, but we think that all of these factors are interplaying, with the exception of certain things called BRCA, which we'll talk about next. Okay, so only 5% of breast cancer are due to a known genetic problem. A mutation is just a mistake in the genes. Okay, so only 5% of breast cancers are due to known inherited genetic causes. How many of us on this call, by a show of hands, have heard of the BRCA gene? Angelina Jolie, I believe, tested positive for BRCA, and it was very high profile about 10 years ago. Anybody else have heard of BRCA? Okay, so BRCA1 and BRCA2, they are two genes that are strongly associated with the development of breast cancer. Yeah, thank you very much, SB. I can see a thumbs up. Thank you so much. Thank you so much for that. It's not important which chromosome they sit on. I've just put that on there in case people are interested. But if you carry, ladies who carry BRCA1, they have a lifetime risk of developing breast cancer of between 65 to 85%, okay? Which means if you carry BRCA, you have the likelihood of you developing breast cancer is about 2 in 3 or 4 in 5 or just over. But there's also a 15% chance that you'll be okay. And that increased risk is also reflected in higher rates of ovarian cancer. Men who carry BRCA also have a higher risk of breast cancer. So if anybody's got BRCA, their men should also be screened for it. BRCA2, again, similar lifetime risk of breast cancer and slightly less risk of ovarian cancer. And there is also something called the TP53 mutation, which I'm not going to go into. Other risk factors, having a child after 30 or never bearing a child. Now, we live in a society where a lot of us are having children after 30. Having a child after 30 does not give you breast cancer, it just means that you're a little bit more likely to develop it. Breastfeeding is thought to be protective. And again, for any lady who has not breastfed, please do not leave this call thinking that because you didn't breastfeed, you'll get breast cancer. That is not the case. It's just a risk factor. Lots of ladies do not breastfeed, and lots of those ladies do not develop breast cancer. Early onset of periods and having menopause late in life. And of course, what we call the Western style diet. So a lot of fast foods, processed foods, pizzas, takeaways, baked goods, chocolates, all these yummy things. They're not good for us, ladies. We should all be trying to follow what's called the Mediterranean style diet. So lots of salads, lots of grilled fish, lots of olive oil, yeah, lots of fresh foods. So HRT has never been as high profile in my working life as it has been in the last 12 months. HRT with estrogen alone is associated with very little or no change in your breast cancer risk. HRT with estrogen and progesterone can be associated with increased cancer risk. So risk assessments for breast cancer with HRT have to be done on an individualized patient basis. Now, whenever I speak to a lady about HRT, I can assure you those consultations go on for 20 minutes plus, because there is a lot of information that I have to understand about that specific lady, and then it helps us to work out together whether this is the right thing for her or not. Okay. And we know that risk is related to treatment duration. So the longer you're on HRT for, then that is related to your risk. But when HRT is stopped, then the risk reduces. And there is a very small risk of breast cancer increased with taking the combined oral contraceptive pill. However, most of these cancers, when they're found, have not spread. They're still within the breast. So how can breast cancers present to us as ladies? Ladies, we must look for changes. We must get to know what is normal for us. When I start to do the practical shortly, I must emphasize, and I'll say it again, we are not looking for lumps. We are getting to understand what is normal for us. So we need to look for changes. We need to look at the nipple. We need to see if there's any discharge, any blood coming from the discharge. Even a little bit of blood, ladies, is important, okay? Any nipple retraction. Retraction just means really that rather than the nipple being pointed out like this, okay, that it just starts to pull back in on itself like this, okay? It starts to look like it's pulling in. That's retraction of the nipple, okay? We must look for any skin changes. Now, I can't see the ethnicities of most of the people on this call, but if you have light skin or Caucasian skin, then you'll be looking for redness. If you have darker skin like myself, you'll be looking for any areas of darkening, okay? Any changes in the color of your skin, we need to know, all right? It may not be, essentially what I'm saying is that redness in white skin is often the equivalent of darkening in dark skin, But if you look at an area on your breast and you think, well, that's a bit lighter than it used to be, then we also need to see it. Any areas that are itchy or scaly, we need to see. We're just looking for change, ladies. Okay, and of course, lumps in the breasts or even lumps in the armpits. Now, why lumps in the armpits? Do you remember our diagram of the breast with the small green things that are linked up together that we call lymph nodes or glands? Lymph nodes or glands are very, very important in draining what's called lymph from the breast. So if you find that you have an enlarged gland in the area that drains the breast, which is essentially neck, this area here, armpit, and the side, if you find any enlarged gland, that should not be ignored. Okay, we need to see it. We need to see it in general practice. And of course, other ways that breast cancers can present are by mammograms. Okay, mammograms, the NHS, ladies will be invited between the ages of 50 and 70. There is a 3-year period where essentially they need to call you between your 50th and your 53rd birthday. If it gets to your 53rd birthday and they have not called you, then it is reasonable to assume that something has gone awry. And so in the, I think maybe the next slide, I will show you how to get in touch with the mammogram teams in whichever locality you live in. Fine, here we are, so mammograms. You'll be invited every 3 years between the ages of 50 and 71. Of course, if you're a trans man or a trans woman, or you're non-binary, you may be invited automatically. But if you feel that you have been overlooked, then you need to contact the local breast screening service, okay? Once you are 71, you will no longer be automatically invited. However, if you want to have your mammograms every 3 years after 70, you still can. And this is a little known piece of information. You still can, okay? And the link to back up the above is on the NHS website, okay? Feel free to take a screenshot of this link, ladies, but also if you just type into the Google mammograms after 70 NHS, it should bring you to this page. Okay, so I'm going to click away from the screen in 5, 4, 3, 2, 1. I'm happy to come back to it later. If you've missed your mammogram, and of course, let's not forget, we're just coming out of COVID-19. So a lot of the usual screening processes were really up in the air, or people who were vulnerable were not keen to attend these things because they were shielding. Then it's very, very easy to rebook. If you live in Croydon, essentially the link I've posted on there, if you follow that link, it will ask you to type in your postcode. That postcode will bring you to a page that shows the South West London Breast Screening Service. I know you all know this, but I just need to tell you, it's not a drop-in service. Everything is done by appointment. And their phone number is 0208 725 4868 or 0208 725 4898. If you need to rebook or you've missed out, you've been abroad or whatever, then these are the people to contact. You do not need a GP to refer you to breast screening. They are very, very friendly, very helpful, and they liaise directly with the patients, okay? They don't need us to tell them to screen you. They do this entirely separately. So how do we do breast self-examinations? Now, first question is when? The guidelines say we should examine ourselves about every 4 to 6 weeks. If you're still lucky enough to be having periods, should be in the week following your period. If you're lucky enough to have finished with your periods and you're now in the menopause, then just pick a day each month that you're likely to remember. Doesn't really matter hugely. The day you get paid, the day you pay your gas bill, the day your pension comes in, doesn't matter. Just pick a day that is significant to you and stick with it. If you forget the odd month or two, it's not the end of the world, just as long as you have an awareness of what's happening. Okay, now what do we need to do a breast self-examination? You will need a mirror that shows, I don't know if you can see me very well, this much of you. So you can see all the way down to roughly your belly button. Okay, you'll need good lighting. And of course, you need to be stripped to the torso. All right. Now, I'm going to take you through the technique first by pictures, and then I will demonstrate it practically. So we will go through this twice. If at any point you feel I'm going too fast, just put up your hand. Fine. So what am I looking for? Once again, we are not looking for lumps. We're getting to know what's normal for ourselves. Once you know what's normal for you, it's so much easier to spot a change. And if you think you are not sure, then that's good enough for us. Please come and we will see you. Sometimes, I mean, I've been examining breasts for a long time. I've been a GP for 2011. How many years is that? 11 years. And sometimes I'm not sure. Even in the hospital, sometimes I'm not sure. If you're not sure, please come. Okay. So we're going to look for changes in the outline. Okay, you're going to look for changes in the outline of your breast, in the contour of your breast. Okay. You're going to look at the skin of the breasts. We're going to look at the color, the nipple, and the shape. Now, I'm going to turn my orange around. I've been saving this for 2 weeks. Okay. Now, I hope that that orange is in focus. Okay. Let's assume this is the nipple. Okay. You will see that the area around the nipple doesn't look at all healthy. It's got blotchy changes of the skin. It's got lumps and bumps. And if you come really, really close, can you see that the pores of the orange are very prominent? Lorraine, I just need you to give me some feedback about the clarity of the picture. Can you see the little tiny, tiny holes on the breast?
Yes, yeah.
Okay. That is an actual clinical sign. It's called peau l'orange, which means the skin of the orange. If you look at your breast, ladies, and you see that it is looking like it's got lots of really prominent pores, there might not be a lump there, but that is a significant skin change. We need to know about it. Okay. And of course, any rashes that you see, any itchy areas, we need to know. Most of the time, the rashes are harmless, but we don't expect you to make that decision. Please come and see us. So how legible is the writing on this slide?
We can't see the writing.
You can't see the writing. Okay, fine. Thank you. So I have borrowed the slide from an NHS website, which I will quote in my references. The first picture says that we're looking for a change in size or shape. Most ladies' breasts are asymmetrical. One is usually a bit bigger than the other. If they have always been different sizes, that is okay. That is normal for you. But if you suddenly notice that one of them is getting bigger than the other, then that is important, even if there are no lumps. The second picture describes redness or a rash on the skin or around the nipple. We've already spoken about rashes or about redness or areas of darkening or areas of skin lightening on the breast. The bottom picture speaks about a lump or a thickening that feels different from the rest of the breast tissue. Now, this is where a lot of ladies get confused. They say, how do I know it's a lump? It's very easy. Mother Nature has given you two, okay? If you feel one and you think, is there something there? Check on the other side. If the other side feels the same, then it's probably okay. If you feel it on this side, but when you check the other side, that feels different, then we need to know about it. Mother Nature has been very kind to us. She's given us a live comparison, okay? And if you're not sure, then please come, okay? The picture also speaks about areas of thickening. Thickening is essentially, most of us, if you go like this, it feels normal consistency. If you go like this and you think, what's that funny linear lumpy thing there? Yeah, again, it's change, it's different. You need to know about it. And the last picture speaks about puckering or dimpling like an orange skin. And we've already had a look at my old orange to demonstrate that. These links will be at the end, by the way, so you can see them for yourselves. Now, The next page speaks about discharge, or discharge is liquid that's coming out from the nipple without squeezing. You will notice this if when you take off your bra and when you look inside the bra, you can see something has come out of the nipple. It could be white, it could be yellow, it could be bloody. The exception, of course, is if you're breastfeeding, yes? But if your breastfeeding days are behind you and suddenly you notice that your breast is producing milk, it probably isn't breast cancer, but please come because we need to have a look into it to understand what is happening. If you look inside your bra and you see small amounts of sort of brownish, you look at it and you think, is that old blood? Again, please don't neglect it. Please come, we'll take a look, okay? The next picture speaks about a swelling in your armpit or in your collarbone, and we've already talked about the glands, the lymph nodes, and why an enlarged lymph node should not be ignored. The next picture at the bottom says about the nipple becoming inverted, which is pulled in. An inverted nipple is the one that, rather than pointing outwards, it starts to just look like it's pulling in a little bit. And what ladies will sometimes report is that they've noticed when they first take off their bra, one nipple looks a little bit flat and they just have to tease it a little bit to get it to point out. If that is new for you, then that is a change, okay? Even if it doesn't stay inverted, if you take off your bra and one nipple seems to have been flattened and you tweak it a little bit and it pops out and it keeps on doing this, and this is not normal for you, then we need to know about it, even if there are no lumps. And again, constant pain in the breast or armpit. Now, pain is a really interesting one, and even breast specialists disagree, but the guidelines tell us this. If it is in a lady who is still seeing periods, if you have pain in the breast that persists after one menstrual cycle, then the clinic needs to know about it. If you have pain in your breast and you have a period and the pain persists, then please come and see us. We need to let the hospital know. If you are a lady who is no longer seeing periods and you develop a constant pain in the breast, in the armpit, in the breast or in the armpit, then we need to know about it again. Okay, let's move on. Right, now, how do we feel? How do we examine our breasts? Here's another orange. We are not using our fingertips, ladies. We're not checking an avocado for ripeness, okay? We are using the flat of the fingers in small circular movements, okay? I'll demonstrate that from different angles. The flat of my fingers in small circular movements, okay? Now, I'll demonstrate on myself. I am not using my fingertips. Can you see me clearly? Or shall I come closer to the frame?
No, that's perfect.
Okay. I'm not using my fingertips and going like this, okay? I'm using the flat of my fingers in small circular movements, and I'm pressing just enough so that I can just about feel my rib cage, okay? If you're very generous in the cup, then what you might find very helpful is to lie down and pop your hand behind your head, because when we lie down, that causes the breast to spread out a little bit. When you lie down, just make a mental picture and imagine you've divided your breast into 4. Draw an imaginary line down through the nipple, an imaginary line across. So as you examine, make sure you check all 4 quarters. Check here, check here, check here, and check here. And don't forget the nipple. One more time, ladies. If you're generous in the cup, please lie down. Imagine your breast is divided into quarters. Draw a straight line down your nipple and a straight line across your nipple. Now you have 1, 2, 3, 4 imaginary quadrants. Check the inside one, check the outside one, check the bottom one, and check this one. And you're applying enough pressure that you can just about feel your ribs. You won't be able to feel your ribs completely, but just so that you have an awareness of where your ribs are. Needless to say, you shouldn't press so hard that it hurts, needless to say, okay? And don't forget the nipple. I'm going to put this link at the end, please remind me, I'm going to put this link on the chat, which is an excellent, excellent resource. I think sometimes we want to reinvent the wheel. There's no point in me reinventing. I could not do a better job than what this website from the NHS can do. So I'll pop this on the chat towards the end, if you just remind me, please. Okay, so before we move to questions, let me just talk you through the practical for doing this. If I could ask you, ladies, we're all going to stand up and we're all going to try and do this. Feel free to turn off your camera. But most cameras are off anyway, okay? I will demonstrate. The bit where I examine the breast is best done lying down. But you could also do it in the shower. It's up to you. Some people find it easier to do it if they've got a soapy finger, okay? So you can examine, but we will go through it. Okay, so I'm going to stand up now. So I'm going to imagine that I'm standing in front of my mirror, okay? First thing I'm going to do is to pop my hands behind my head. And what this does is it lifts the breasts, okay? It lifts the breasts, and I'm just going to look in the mirror. I'm going to look from one side with my eyes across to check that the outline, the contour of the breasts is the same from one side to the other, okay? While I'm here, I'm going to have a look at the nipples. I'm going to make sure that they look the same and that they're both pointing outwards. Then I'm going to bring my hands onto my hips, like so, and I'm going to press very hard into my hips. I'm going to press into my hips. And as I do so, I'm going to keep my eyes on the mirror looking at my breasts. As I press down into my hips, I am checking to see whether the breasts continue to look the same. Is there one breast perhaps where as I press down, the nipple starts to pull in? Is there one breast perhaps where as I press in, I start to see ridges? I start to see a ridge appear, okay? Is there one breast perhaps that when I press, the nipple adopts an unusual shape? I cannot possibly cover all the possible changes, but you're looking for change. You're looking for where the one breast looks quite different to the other when you press down. One more time. Hands behind the head, visual assessment, just check the right one, check the left one, check the shape, check the nipples, then bring your hands down, rest them on your hips, press down into your hips, hard as you can, and look in the mirror and just see that the left breast and the right breast continue to look normal. Any areas of indrawing, we need to know about. Any changes in the nipple, we need to know about. We now lie down, and as we lie down, we pop one hand behind the head. We're going to use the flat of the fingers, and we're going to do small circular movements, working our way around all 4 quadrants of the breasts. Okay, take your time, there's no rush. Okay, and then we're going to feel behind the nipple, we're going to have a press, we're going to see if we find any lumps. Now, I hope that we have learned today that it's not just about lumps. It's about skin changes, nipple changes, discharge. My apologies, my toddler is not happy, but that's life. About skin changes, nipple changes, discharge, enlarged glands, pain, scaly areas, dark areas, and finally lumps. As I said I would do, these are my references, which I will also pop on the chat. Oh, it won't let me. Oh boy, what have I done? If it's okay, Lorraine, please allow me to send you the links.
Yes.
I'm going to stop sharing if that's okay.
Yeah, that's fine.
Thank you. Please allow me, Lorraine, to send you the links by email.
Yes.
And perhaps you could then share them with the ladies, plus the very, very excellent NHS link, which is actually designed as a booklet. This booklet also has at the bottom of it, how to support somebody who has a learning disability, on how they can also be breast aware. Because let's not forget that we also have people under our care who need additional support, and they're also ladies, and they also develop breast abnormalities. So let's have this information, let's share it, and let's look after each other. At this point, I'll hand back to Lorraine, and thank you once again for this opportunity and for your time, ladies. I'm greatly honored.
Thank you so much. Thank you. I'm not sure, I haven't seen any comments in the chat yet, but I have learned so much that I wasn't aware of, and things that we should look out for that are not really discussed or publicized anywhere. I think there's a lot of false information about breast cancer out there where we're not sure what we're actually looking for. So we wouldn't be looking, because I've never heard to just look for changes, just generally, as soon as a change occurs, especially in the skin as well.
Yeah, absolutely.
I have been holding focus groups around this topic, and the question keeps coming up with different age groups, that if you do find an abnormality or something, or a change occurs and you want to speak to your GP about it, the GPs are very reluctant to speak to people if you're under a certain age group. Okay. So it's hard to get an appointment. So is there any advice that you can give us on how we can get our GPs to take us seriously if we do believe there has been a change that needs to be looked at?
Absolutely, Lorraine. And let me just make a note. I will send the link to the page, the details that breast cancer in under 25 is very rare, but it's under 5%. Okay. Yeah. But under 5% does not mean zero. Okay. And so what I would say to any lady on this call, or anybody in your wider circle, is I am a GP, and I try and be very reflective in my practice. Okay, stop and think and ask, what's happening here? It may not be breast cancer, but is this patient worried? Because if they're worried, that's also a legitimate reason to be seen. If you call and the person you speak to doesn't, they're not taking it on board, very few practices have only got one doctor. Okay. Just take note of who it is and speak to their colleague. Next time, try and book an appointment with another GP. If you feel that the GPs are, they're not, we're not too persuaded by this story, go and speak to the practice nurse. Say, look, I've come 3 times. Yes, I've spoken to 2 GPs. I'm still worried about this. And just say, look, I don't necessarily think I have breast cancer, okay, because I'm quite young, but I just want somebody to examine me and reassure me, okay? And sometimes it's to do in, there almost sort of a few kind of buzzwords that catch our ears, a patient is looking for reassurance. You can't help, but try and help them, because we have all been worried about things at some point. Yes, we're GPs, but we are also patients and we're also humans. So if you go and you feel that you didn't get your expectations met, please don't despair. Please come again, okay? Please speak to another colleague. And if need be, please get the practice nurse, to also speak to us. I can't think that the practice nurse has ever spoken to me about a patient and I have said, yeah. So just, there are little ways, let's help each other. Let's help each other work together. Yeah. Okay. And I'm sorry if anybody's felt a bit fobbed off. It's not our intention. Please keep coming. We're not going anywhere.
Thank you. We have a question in the chat. They said, if under 35, can you get a mammogram? Oh, I think you're frozen.
My screen has frozen.
Yes. Oh yeah, we got you back now.
Okay, that's lovely. Thank you.
So yes, we had a question in the chat that said, if you're under 35, can you get a mammogram?
Not on the NHS, you can't.
Okay.
And to my knowledge, even in the private sector, they wouldn't do them under 40. But if you are under 35 and you have breast symptoms, then you would then go in through the breast clinic route, and they will do whichever diagnostics are relevant. Okay. But no, the answer is no, not in the NHS, you won't get a mammogram.
Okay. Next question is, should males look for the same symptoms?
Yes.
Yeah.
Yes. In a word, yes.
Okay. Okay, I got another question. I think it's meant to say, I've heard there is an aggressive form of breast cancer that affects African Caribbean women. Are you aware of this?
I'm not sure that there is any cancer that is specific to African Caribbean women, but I am aware that we generally have worse outcomes when it comes to breast cancers. Our breast cancers tend to be more difficult to treat, and they also present later. But I'm not aware that there is a breast cancer that just targets us.
Yeah. Okay. Yeah, I think that's all the questions in the chat. Are there any more questions that anybody wants to ask? Oh, a follow on from the question before, why are they difficult to treat?
I think that would be one for my oncologists to answer, because the treatment of breast cancer is not something that I have ever had to do in my professional life. But let us remember that breast cancer is a condition that affects all women of all races. There are some cancers that are known as triple negative, and they pose a challenge to the oncologist, but they can still be treated with chemotherapy. Triple negative just means that, right, now let's assume that this is a breast cancer cell, okay? It has lots of different receptors. A receptor is basically like a little door on the cell. Cells have lots of little doors on them, okay? And depending on what's knocking on the door, determines which door is open, as a general rule. Think of your cell as like your house. So I can enter your house through many different doors. You've got a front door, a patio door, a kitchen door, blah, blah, blah. So most breast cancers, well, okay, so when we look at breast cancers, there are 3 types of receptors. There's one called the estrogen receptor. There's one called the progesterone receptor. And then there's one called the HER receptor, which stands for human epithelial growth factor, HER2. Essentially, the triple negative breast cancer cell has no estrogen receptor, it has no progesterone receptor, and it has no HER2 receptor. So a lot of the very clever anti-cancer drugs that people have made have been to target these receptors. Now, imagine I'm trying to get into your house, but you have no doors, okay? You have no front door, you have no back door, you have no patio door. Makes it very difficult for me to enter your house and to effect any changes. It doesn't mean though that, they can't treat it because they'll have chemotherapy, yes? But it just means that the oncologist has to work a little bit harder, and it is not beyond their wit, because ladies, you have chosen very well. You live a stone's throw from the Marsden, which is the oncological center of excellence. Yeah. So no matter what the problem is, I'd say we probably live in one of the best areas of the country for oncological excellence. But I'm so sorry, I am not an oncologist, and I cannot give you any more than the basics.
Yeah. Thank you.
Okay. Is there a stage for breast cancer? Yes, there is certainly, yes. The staging system that we learned at medical school was TNM, tumor, nodes, metastases, looking at, yeah, I'll leave it at that. Again, tumor staging is not something the GPs do, thankfully.
Yeah.
But hopefully BME Forum could persuade one of the oncologists at Croydon Hospital. Yes. Perhaps if we tell them that, a GP has come and there were many questions that arose, could they kindly come and speak on as a follow-on? Let's lay down the gauntlet. Let's challenge our secondary care colleagues to come. Tell the GPs have come, they've represented. Now they need to come and do the bits.
Yeah, no, I agree with that. I agree, because we do have a lot of questions and it does get confusing. So it's nice for someone to break it down and simplify it.
Yes, there are plenty of oncologists. We've got Croydon oncologists and we've got the Marsden oncologists.
Is there any link between prostate cancer and breast cancer?
In as much as the risk factors for cancers are usually, there are lots of things in common. Smoking, the Western style diet, inactivity, high alcohol, family history. So yes, there is a link in as much as the risk factors, but these risk factors are common to most cancers.
I have a question actually following on from that, because I've just recently heard that if you're a male and the women in your family have suffered with breast cancer, it's very likely that you will develop prostate cancer.
That's not something I'm aware of.
Yeah, because
I think an association I've heard of. Yeah. But I think it's probably something we could ask an oncologist.
Okay.
If you wouldn't mind terribly, Lorraine, if you mind picking me an email with that question.
Yeah.
And it's not difficult for me to find a friendly oncologist to explain whether there is an association. And then if I get back to you, then maybe you could share the information back.
Yes.
Across. Yeah.
Sure.
Okay.
Let's see. I think I had another question. question. In your slides, I did make a note that you said you don't need the GP to refer you to the Southwest London BSS.
Yeah, no, you do not need a GP referral
Yeah.
for mammogram. So the mammogram screening service is run completely independently
Yeah, okay.
to general practice. They will call ladies between the ages of 50 and 70. If you feel you've been missed out,
Yeah.
then kindly. I said that I would share, I'll put that link on the chat. So please allow me to get my slides up.
Yeah.
And I will put that link on the chat very shortly. Thank you.
Thank you. In the meantime, I'm just gonna launch a poll actually for all our attendees, just to get their opinion on cancer treatment and basically the services available in the Croydon area. Okay, so in a second, you should see a poll come up with 6 questions on your screen. So just take a minute and complete that for me. I'd be really grateful. Can everyone see the poll?
I can see it,
Yeah.
and I have to do it before I can do any.
Oh, sorry.
That's okay. Okay, there we go, ladies. I've put the link on the chat along with the breast screening, the Southwest London Breast Screening Service phone number. They're usually open from 9 to 5.
Thank you. I think we've had about half the participants respond to the polls. I'm going to leave it for another 30 seconds or so.
My apologies. I'm just going to put the cat out.
Yeah, that's fine. Fine.
I'm going to chase him out of the room. Come on, you. Out you go. Off you go. Thank you. Bye. Okay. Thank you.
Okay. Okay, so I'm going to end the poll now.
Thank you.
Okay, I'm not sure if I can share the results at this moment. Let's see if this works because it's very interesting. Okay, so how do you feel about healthcare in Croydon? Would you say supportive of the Black community? So at 57% say no.
Wow, okay.
So when I hold my focus groups, these are questions I ask, and it's interesting to find out why or the background behind it.
Okay.
And how much do you know about breast screenings? Let's see, 71% said a fair amount. 43% said not much. Yeah, but it's good to know. Yeah, no one chose none at all. Nothing at all. 100% are open to the BME Forum organizing events, which I spoke to Dr. Judith about.
Yep.
Face-to-face events would be good.
Sure. The question number 1 about healthcare in Croydon not being supportive of the Black community. I'd like to say 2 things first. The first is that the leadership of what used to be the CCG and now the ICS, they are very, very dialed in to try and improve access and to make access equitable.
Yeah.
And I think this is why you're seeing people like me doing the job that I'm doing as women's health lead. Yes, I would hope that I was appointed on the basis of ability, but I think they are also understanding that there are inequalities in health based on ethnicity, and they shouldn't be there. But I can tell you, having worked with them as colleagues, that there is a lot of willing and people are on the front foot to try and make things better. But say, for example, this evening, thank you so much for the people who filled in the feedback. My only wish would be perhaps that we had 50 other people, because if there are more of us saying that things are not working for us, then we can begin to understand why they are not working. Once we know what's not working, we can try and fix it.
Yeah.
But please keep coming, keep coming. Please don't let any woman who has got breast abnormalities feel that she does not have a voice. Please keep coming.
Yeah. And the more sessions that we do like this as well, we'll all become more aware of what we're actually looking for and able to support each other.
Exactly right, precisely.
Yeah.
So thank you so much, ladies, for your
Thank
time.
you.
I am very grateful, but I have a toddler who's very unhappy.
Yes.
Thank
you. Thank you.
I have to go and wear my other hat.
Yes, that is
Thank
fine.
you so much. Okay, have a lovely evening.
You too. Thank you for joining us.
Pleasure. Goodbye. Goodbye.
Bye.
Bye. Bye.
Thank you, everyone.
Thank you.
If you have any questions or anything, feel free to email me as well, and I'll make sure that our next session covers that or get back to you via email. So thank you for joining.
Thank you.
Thank you, Lorraine. Very helpful.
Bye.
Thank you.